Good afternoon. I'm Michael Munson with Forge. I'm glad that you're all here with us today for this overview discussion focused on the non-discrimination provisions in the 2013 Reauthorized Violence Against Women Act, specifically around sexual orientation and gender identity. Forge and the National Coalition of Anti-Violence Programs, NCAVP, have joined forces to bring you this webinar, and we're pleased to have the opportunity to share information with you, helping you better understand the non-discrimination provisions and what both Forge and NCAVP can do to support you. Many of you who have been on a Forge webinar before or at one of our workshops in a conference have seen this slide. We just want to remind you that we will be sending out the PowerPoints that you'll be seeing today. You'll receive an email tomorrow that has a link to the PowerPoints. It will also have a link to the recording of this webinar. So if you're not able to stay the whole time, or if you'd like to share it with a colleague, we encourage you to share that email with the links for both of those in it. We also want to show you the link to the FAQ that was produced by the Department of Justice, and the FAQ is called the Frequently Asked Questions, Non-Discrimination Grant Conditions in the Violence Against Women Reauthorization Act of 2013. So a very long title for a relatively short document, and we encourage you, if you haven't already, to download that document. It's 11 pages. You'll see the link a couple of times today. So it's something that we think is really important that you have on your desk or in your computer to reference frequently. We are limited today to 60 minutes, so it's a fairly short time that we're going to be together. But if you have questions as we move through, please feel free to find the question area. Generally, it's on the right side of your screen, and you can ask technical questions, which we can hopefully address real time. And then if you have any questions that we can address later on in the webinar, you can ask them there as well.
Michael, I am getting a request that you speak up.
I can do that. So let me just review a little bit about the agenda for today. We're excited to have this opportunity to talk to you about the new Violence Against Women non-discrimination conditions within the Department of Justice's guidance FAQs that were issued earlier this year. We'd like to share with you a little bit about who we are, both NCAVP and Forge, and then highlight some of the points in the FAQs before sharing with you some of the ways that we can better help you serve your transgender, lesbian, gay, bisexual, and queer and questioning clients. We'll make sure to leave time at the end to discuss some of your questions. Again, so you can put those questions in the question box. And a reminder again that we have 60 minutes today, so if we do not get to your question, we will do our best to respond to you privately afterwards or direct your questions to the appropriate person. So let's just do a little bit of a go-around of who's here today. Chai, can you introduce yourself?
Sure, thanks, Michael. Hi, everyone. This is Chai Chindasurat. I'm the co-director of Community Organizing and Public Advocacy at the New York City Anti-Violence Project. And through that role, I oversee the National Coalition of Anti-Violence Programs, NCAVP, which I'll talk about in just a minute. And before that, I was actually the coordinator for NCAVP before I became kind of co-director of our department. And my pronouns are he, him, his, and they, them, theirs. And just a kind of quick overview of my background. Before I came to New York to coordinate NCAVP, I was doing LGBTQ organizing at the Network Lared, which is an LGBTQ domestic violence organization in Boston. And before that, I got my start doing this work in Kansas City at the Kansas City Anti-Violence Project. And started doing LGBTQ organizing about 10 years ago, and that's kind of how I got into this work.
Great. Thanks, Chai. And again, I'm Michael Munson. I'm Forge's co-founder and executive director. I've been involved with transgender advocacy and activism for over 20 years, and I've been doing anti-violence work for over a decade in a formalized capacity. So that's the thumbnail for me. And Lori, can you tell us a little bit about who you are?
Yes, this is Laurie Cook-Daniels. I'm the Policy and Program Director for Forge, and my job today is to try to handle managing the questions. So I'll be busy with that today. Thank you.
Great, thanks. So that's who you've got today. Laurie, again, will be behind the scenes, and Chai and I will be doing most of the talking today. We wanted to give you a little bit of an idea of who both organizations are, just a thumbnail before we get moving. So Forge is a trans organization, a transgender organization. We are 100% funded to focus on anti-violence issues related to transgender survivors. We were founded in 1994, so that makes us 20 years old this year. And although that we are headquartered in Milwaukee, Wisconsin, our work is national in scope, with only very limited pro bono work that we do here in Wisconsin. We work primarily with victim service providers, so around 65% of our time and effort and money is devoted to victim service providers. And we also work with transgender, gender nonconforming survivors and loved ones, around 35% of our time and effort. We have two foundational principles that guide all of our work. When we engage with both survivors and providers, our first goal is to approach this work through a trauma-informed lens. And the second foundational principle, again, when we work both with survivors and with providers, is to focus on empowerment through highlighting resilience, building on existing knowledge, and promoting a sense of confidence. So that's the small sketch of who Forge is, and you'll hear a little bit more about what we do later on. So Chai, can you talk to us about NCAVP?
Chai, are you muted?
I was. Thanks, Lori. I was just going on. So NCAVP is the National Coalition of Anti-Violence Programs, and we are a coalition of lesbian, gay, bisexual, transgender, queer, and HIV-affected anti-violence organizations from across the country. We currently have 49 member programs in our coalition, and we really have a diversity of membership programs that are part of the coalition. So some of our member programs are all volunteer organizations, low to no budget organizations organizing in their communities, all the way up into kind of very large standalone LGBTQ anti-violence organizations. Some of our member programs are part of LGBTQ community centers. Some are part of domestic and sexual violence programs that have LGBTQ projects. So we really have kind of a diversity of members. We were originally founded in 1995 through some different LGBTQ anti-violence organizations that really started to come about in the late 70s and early 80s. And they wanted to have a national coalition so that everyone could kind of come together and share resources and build more of this LGBTQ anti-violence movement. And we're currently a program of the New York City Anti-Violence Project. So that's kind of where our staff time for NCAVP is through the New York City Anti-Violence Project. That's where I'm calling from today. And the kind of main coordination happens through New York. And we come together to advance a national agenda on LGBTQ violence, anti-violence, and so there's our mission. We work to prevent, respond to, and end all forms of violence against and within the LGBTQ and HIV-affected communities. And we come together and use a variety of different social change strategies, including policy advocacy. We do a lot of policy work. We also do national research on LGBTQ violence. We have 2 national reports we produce, one on hate violence against LGBTQ communities nationally and one on intimate partner violence within LGBTQ communities, as well as some movement building work we do for the coalition members. And through the Office on Violence Against Women, we actually coordinate a national LGBTQ Training and Technical Assistance Center, which we'll talk about later on in terms of what resources and support we can offer to all of you and to the field on LGBTQ cultural competency. And I think we're going to move into now talking about the changes to VAWA. So I'm just waiting to see that slide change, but I'll go ahead and get us started. So the reauthorized Violence Against Women Act with the non-discrimination provisions offers more options for more survivors. The revisions really allow providers to better serve people who have been affected by sexual assault, domestic and dating violence, and stalking. And we're really excited to have this opportunity, which we hope will be one of many, to share some of the new provisions in VAWA. And we wanted to just give you a small taste of what some of the new provisions are and how we can help support you. And although some of the new non-discrimination provisions may seem challenging, we believe that they are a win-win because they will encourage organizations to expand coverage to more survivors, and more survivors will be served. And so what does this mean? What's new? On March 7th, 2013, President Obama signed the Violence Against Women Act Reauthorization of 2013, which amended the 1994 Violence Against Women Act by adding a grant condition that prohibits discrimination by recipients of certain Department of Justice funds. And that states, no person in the United States shall, on the basis of actual or perceived race, color, religion, national origin, sex, gender identity, sexual orientation, or disability, be excluded from participation in, be denied the benefits of, or be subjected to discrimination under any program or activity funded in whole or in part with funds made available under VAWA, and any other program or activity funded in whole or in part with funds appropriated for grants, cooperative agreements, and other assistance administered by the Office on Violence Against Women.
Thanks, Chai. That was, I know that paragraph is a mouthful to read and comprehend, and so we're going to try to break that apart a little bit as we move forward in the next couple of slides. So to clarify and highlight the new non-discrimination provisions in the Reauthorized Violence Against Women Act, the Department of Justice issued guidance to grantees in the form of an 11-page document that I mentioned before, and that document is called the Frequently Asked Questions, Non-Discrimination Grant Conditions in the Violence Against Women Reauthorization Act of 2013. And once again, the link to that document is at the top of the slide right now, and you'll be getting it in the follow-up email tomorrow as well. In this FAQ, they provide helpful answers to really key questions that grantees might have about the new non-discrimination conditions. They do so through addressing 18 different questions and providing really brief but very informative answers. We wanted to go through a couple of those questions and answers just to give you some highlights as they particularly relate to sexual orientation and gender identity. So a couple of these are, you're going to hear a lot of the language from the FAQs in the next slide, and the next slide. So what does gender identity mean? The Violence Against Women's Act's non-discrimination grant conditions borrows the definition of gender identity from the Matthew Shepard James Byrd Jr. Hate Crimes Prevention Act. Gender identity means actual or perceived gender-related characteristics. Gender identity is a person's internal view of themselves, their gender. Transgender can be used to describe a person whose gender identity is different from their sex assigned at birth. Male, female, and transgender are all examples of gender identities for the purposes of the non-discrimination grant condition. So if we move on to a second question in the FAQ, what does sexual orientation mean? The notes in the VAWA non-discrimination grant condition do not define sexual orientation. The FAQ notes that sexual orientation includes people who are heterosexual, gay, lesbian, or bisexual. The condition also likely covers other sexual orientations as well. So a third example question is around sex-segregated or sex, I'm sorry, let me just go with this again. Services are expected to serve both men and women unless sex-segregated or sex-specific programming is necessary to the essential operations of a program. How will that be determined? If the Department of Justice Office for Civil Rights receives a complaint of sex discrimination based on a recipient's sex-segregated or sex-specific services, the onus will be on the recipient to articulate why sex segregation or sex-specific programming was necessary to the essential operations of the program and the circumstances surrounding specific program. and to also take into account established best practices and research findings as applicable. The justifications cannot rely on unsupported assumptions or on overly broad sex-based generalizations. In addition, a recipient should not assume that because services have been previously sex-segregated or sex-specific in the past, that continued sex segregation or sex specificity is necessary to its programming right now. So fourth example is, what is sex-segregated or sex-specific programming? Programming is sex-segregated when males and females receive services in separate settings. Programming is sex-specific when a recipient designs it differently for males and females. Both sex-segregated and sex-specific programming places individuals into a position to choose to identify with a particular sex. Transgender survivors are to be given the choice as to which sex-segregated or sex-specific program they belong in and feel most comfortable in, and which choice is the safest for them.
Michael, this is Laurie again. Sorry to interrupt you, but I'm still getting people asking you to speak up.
I will do my best to do that. So although we won't go into specifics on today's webinar, a couple of the other questions that are addressed in the guidance FAQs include what constitutes discrimination based on actual or perceived race, color, religion, national origin, sex, gender identity, sexual orientation, or disability. And what does it mean when a recipient cannot discriminate in any program or activity funded in whole or in part with VAWA funds? We're hoping that some of these examples of questions that are answered in the FAQs will encourage you to take a deeper look and read those FAQs in their entirety and study them. So Chai is going to talk to us next about some service implications.
And great, thanks, Michael. So the new conditions do have some specific service implications for serving LGBTQ survivors and clients. And we wanted to point out just a couple of examples. So the first is that the changes will mostly impact services that are sex segregated, like support groups and shelters. And this impacts LGBTQ people because, of course, gay and bisexual men are male, and many shelters and support groups in existence are designated as women only. So some agencies may also be concerned about how lesbian and bisexual women will fit into predominantly heterosexual support groups or shelters too. Sex-segregated services have also historically been difficult for survivors who are transgender to access. And agencies will now need to provide the same or comparable services like support groups and shelter to all survivors, including those who are gay, lesbian, bisexual, and to those who are transgender or gender nonconforming. And in addition to that, as mentioned on the previous slide, lesbian and bisexual women might currently be experiencing some exclusions to accessing services, but since most services are available to women already, many lesbian and bisexual women are already included in these sex-segregated services. But gay and bisexual men, as well as transgender people of any gender vector, will be most affected by the new VAWA conditions. Since so many agencies are not yet prepared to serve these populations, it may take some restructuring, rethinking, and reintegration efforts to ensure that services are not being denied or limited based on an individual's sexual orientation or gender identity. And for more information, we strongly encourage you to download and read the 11-page FAQ. Here is a direct link where you can find the FAQ. It's very easy to read, and it's an important quick reference guide to many questions you may have. You can find it online at this link on the screen, as well as a link on Forge's website, and we'll be adding it to NCAVP's website as well. So we'd like to now transition into kind of what our role can be both as NCAVP and as Forge to the field in supporting everyone around these changes. So Forge and NCAVP are the two trans or LGBTQ OVW national training and technical assistance providers. And you've already heard a little about each organization, about who we are and kind of what we do. But we wanted to share with you some specific examples of how we have helped OVW grantees and communities in the past and how we can assist all of you on this call. And we want to really stress that both Forge and NCAVP are here to help you. So I think next Michael is going to speak to some examples of how Forge can help.
Great, thanks, Chai. And I know that people are still having a hard time hearing me, and I'm speaking as loud as I can, so hopefully this is better. Both Chai and I will be sharing some examples of what each of our organizations has done to support other OVW grantees and what we can do to help you, specifically around making changes or gaining more knowledge around the non-discrimination provisions in the Reauthorized Violence Against Women Act and how you can better serve LGBT survivors. So some of you have seen the screen, which we use in all of our trainings, just to give a framework of what we can offer both providers and transgender survivors. So just a quick review of what we can offer. We do a lot of one-on-one support. So people call us or email us with a particular question or challenge or something that they'd like to know. And we respond as best we can to helping them find the information that they're looking for. Sometimes that exchange is literally a one round of email, and sometimes the exchanges go on for months to try to work through like policy changes or other things. And you'll hear a little bit about that in a little bit. We offer monthly webinars, so you will hopefully have known about our monthly webinars, and if you'd like to get on our mailing list, please feel free to contact us and we'll sign you up for our listserv so that you can hear about upcoming webinars. Once a month, every month, and they're free and available to anybody that is working with survivors. We offer trainings both at conferences around the country as well as by request. So sometimes we go to communities when they've requested some additional information, and we do kind of in-service type trainings there. We do as many trainings as we can to support people in the most effective ways possible. The other options for technical assistance and training are the publications that are on our website. We have I think 30 or 40 publications right now that are available, and we'll be adding several new critical publications, very long publications in the near future. So stay tuned for some of those. And I wanted to share a little bit about the support that we offer for transgender survivors, because I think it benefits providers to know what services are available through us and through others. So we do offer a 24/7 listserv where survivors can reach out to each other any time of day or night. And that's just, obviously that's useful for a lot of people to just know that somebody is out there. We do maintain a fairly large referral database, mostly of therapists and anti-violence programs, so those programs that are in member organizations of NCAVP, as well as support groups throughout the country. So you can feel free to call us and ask us for some of those referrals, or your transgender clients can as well. And then we offer two other programs. One is a Ready to Heal online course, which we offer throughout the year at different times. We're in the middle of one right now, and it's always a really exciting opportunity because it allows transgender survivors and loved ones to access healing services from anywhere in the country as long as they can get themselves to a computer. So a library computer, we send them the rest of the materials that they need. So that's a resource that we're really pleased to offer. And the other thing that we are offering for transgender survivors is called the VAWA project, and it's a photographic and narrative project where we're helping people capture an image of themselves, a photo, and then helping them craft a statement of resilience to bolster their healing. So that's the overview. Let me give you three specific examples of how we've worked with OVW grantees in the past, and it'll give you some idea of what we can offer. So over the past 2 years, we've been working with an agency in the South that has constructed a multidisciplinary team of community providers who want to become better informed about trans issues and how to make transgender sexual assault service provision better in their community. This team has been remarkable in their desire to improve services, to share resources with each other, and to continue to raise the bar of service provision and respect in working with trans survivors. And one of the things that I wanted to note up front is that this team of people have had very few trans survivors actually walk through any of their doors, but they're doing a lot of proactive work, which I think makes it even more remarkable to think about and talk about. So a few months after they formed a couple years ago, they reached out to us and asked us to review a brief survey that they developed, which was focused on asking people in their multidisciplinary team about how comfortable they were with trans issues, how experienced they were in working with trans populations, and some other baseline questions. Their initiative was just remarkable, and we reviewed the survey and offered some comments about maybe how they could change it and make it stronger. And then after they collected their data, we were an outside reviewer of their survey, and we offered some suggestions and some observations about where they could move their continued work on better serving trans survivors. They have continued to work on skills building, and they continue to meet regularly. In fact, this is one of several groups across the country who are meeting on the days of our webinars, monthly webinars, and they discuss the webinar after the 90 minutes of the instruction. So they're having both education, and they're having some discussion about how it applies to their agencies and the people that they're serving. The work group has also reached out to us one-on-one in specific situations over the last couple of years, including accessing support around developing different policies, better procedures, and best or better practices for serving transgender survivors. We've been able to help them, and we're able to help any other OVW provider as well, increase those things so that they can better have those underlying things in place when a transgender client does walk through their door. They've determined they're at a point now that they feel really comfortable with trans issues in general, and they'd like to take it up a step. And so we're in communication with them about possibly coming down for a 1 to 2 day training that's in person in their community so that they can kind of reach the next step for them. So that's one example of how we've helped OVW providers. A second example is a community in Iowa where Forge staff did some in-person assessment, both of the trans community and the providers within the state, and then convened a 2-day meeting with both trans community members and a wide range of organizations and providers. This is another example of where communities were working together and actively seeking solutions. So part of our work was to simply help facilitate the dialogue between trans communities and providers. You know, even though we did come in and do a structured 2 days of training, the benefits of that time together was more about the conversations that happened as well as the outreach in both directions. So providers outreaching to the trans community to providers. One of the results of the initial connection was to continue the work between these two populations. And since then, the sexual assault providers have actually participated in a trans health symposium. That was the first ever in the state. And trans community members have become more involved as volunteers, as peer educators, and in helping survivors access services through these providers who are now better educated and better prepared to serve them. And then the third and the last example that I'll share with you today is another set of in-person trainings that we conducted by request in New York State. This was a campus community that reached out and wanted several sets of trainings, and we narrowed it down after working with them for a couple of months to 3 trainings for 3 very specific and distinct audiences. So to give you a sense of what we ended up doing based on what their needs were and what we could offer them, the first training that we did was a Trans 101 with anti-violence information that was threaded throughout. This was a really large training where student organizations, residence hall staff, campus police, dean of students, community providers, and many others attended. And the goal was to help those who work with students on campus be better able to be sensitive to trans students in general, and also then to be aware of what to do and some of the unique things that may need to be kept in mind when a trans student has experienced sexual assault or dating violence on campus. The second training that we did there was specifically for service providers. It included both campus staff, law enforcement, and sexual assault nurses. So it was, again, both campus and non-campus people that attended, and the focus was simply on better serving trans survivors of sexual violence. And then the third training that we did out in New York was geared towards sexual assault nurses and medical advocates. And this community is a little bit interesting because they have same nurses that are housed both on campus and in other hospitals in the community. So again, it was a diverse group of people in attendance, but we were able to look at those across the line kind of things, the multidisciplinary ways of serving people. And it was a really unique thing because some of them attended the other two trainings and some of them did not. So by offering these customized trainings, it really allowed us to talk to people in detail and have some dialogue rather than a webinar format, which can be great, but it's more information going one way. So we had a lot of dialogue and in-depth conversations that are continuing to happen even months after the training. So those are a few things that Forge has to offer. And Chai, do you want to tell us a little bit about what NCAVP has to offer?
Yes. So with this slide, it's kind of the broad overview of the National Training and Technical Assistance Center, kind of how it is that we do our training and technical assistance. So through NCAVP's TTA Center, we coordinate a toll-free warm line, which is listed here, 1855 AVP LGBT. And this is a toll-free number that people can call to receive over the phone training and technical assistance, typically during business hours. We also provide a lot of email-based and web-based technical assistance similar to Forge. We coordinate a national listserv where we send out relevant announcements and updates around LGBTQ, important information, changes within the field, trainings that are coming up, that kind of thing. And so if you're interested in joining the listserv, it's a great way to kind of just stay updated on what's going on. And sometimes people will also share success stories or talk about things that are going on with their organization or with their work. They'll ask questions of resources. So it's really just a great way to share information. So if you'd be interested in joining the listserv, you can just let me know by sending me an email. My email is going to be shared at the end of this webinar. And we also have a resource bank of resources from NCAVP member programs on best practices for serving LGBTQ survivors and working with LGBTQ communities. And you can find that on our website at www.ncavp.org. There's a link for our Training and Technical Assistance Center. We also provide national webinar trainings. Currently our webinar trainings are quarterly, and we provide regional training and technical assistance through member consultants across the country. So currently there are 13 participating member organizations that can go out and do on-site, in-person training and technical assistance through the NCAVP TTA Center. So in New York we kind of operate as like the coordinator of the TTA Center, but we have multiple member organizations that are able to go out and do that TTA across the country, and I think there's a real value in that those programs kind of know the regional culture and climate a bit better, and it's also it's a great way for programs to develop relationships with the resources that are closer to them and more local. So a couple of examples that we'll share. We currently are in our third going on fourth year of coordinating the TTA Center. And so for the first 2 years of the project, we actually had, we did a somewhat of a pilot demonstration where we developed with 9 NCAVP members an organizational LGBTQ needs assessment that really focused on a lot of different areas of service and of work. So it included questions about internal policies, about staffing, about comfort and knowledge level, about actual service provision like nuts and bolts, what does it look like, what do forms and data collection look like, what has training looked like, and community engagement like outreach, organizational relationships, knowledge of resources, all of those things. So it's very, very comprehensive. And we partnered with 11 domestic and sexual violence organizations in different sites across the country to take the needs assessment and then engage with us for about a 1.5-year process of really tailored, specific training and technical assistance through that. And it was a really excellent process. We learned a lot, and I think that I think one of the biggest things we learned is that it looks really different depending on the organization, depending on the region, depending on a lot of different circumstances, but that TTA really does need to be tailored, and that the needs of one program may be very different from another program. And the partners that we worked with were not only local direct service organizations like rape crisis centers or domestic violence programs, but we also partnered with a number of statewide coalitions as well. So that kind of shifted our training and technical assistance with them to be about how they can support their member programs with things like policy development, with kind of accreditation, with training, with best practices and technical assistance around LGBTQ service as well. So all of those programs kind of each received their own tailored technical assistance plan based on that needs assessment, and we still use that needs assessment today with our TTA. So if anybody is interested in taking it, it's a really great way to identify different areas of need, and in terms of kind of what we recommend to be LGBTQ inclusive, it's a really great tool to help identify what action steps may need to be taken. This second slide around examples, so we've done a lot of work on internal policy and procedure development, and as I mentioned before, this has been both with local programs that have asked for recommendations, asked us to review their policies and protocols, when they should notify people about their policies, what kind of language is the best to use, as well as working with kind of more of the treetops level organizations like statewide coalitions and national organizations on how they can support the programs that they're already providing TA to around policy and procedure development. And another thing that we did recently through the TTA Center is we actually have a national curriculum. It's a 9-module training on LGBTQ cultural competency that we partnered with Futures Without Violence to develop. It was a really exciting and wonderful process to collaborate with them on developing this. And our member programs that are part of the TTA Center are now kind of out in the world doing this training in TA, as well as myself through the TTA Center. And so those modules include things like, LGBT, all the way from like LGBTQ 101, that like baseline information about language and terminology, to the nuts and bolts of like, how do you change your intake form, and what are the categories that we should be collecting, and how do we ask these types of questions in like effective interviewing, to things like assessment and screening for primary aggressor for LGBTQ intimate partner violence relationships, to outreach. And one that I wanted to highlight, because I think it may be really applicable to a lot of programs that are wondering about this whole like sex-segregated, sex-specific services thing, is the shelter access training that we have developed. And so this is part of our national curriculum, and it's some work that we've been doing for a little while through the TTA Center and through various member programs that have been working with organizations in their area around shelter access. And so there are multiple domestic violence shelters now that are serving men within their shelter, even in kind of co-ed spaces and facilities, that are serving transgender survivors, that are serving lesbian and bisexual women survivors, gay men, all kind of like under the same roof. And so it is possible. And we kind of worked with some of them to see what it took for their programs to kind of go through that process. And so we have a kind of a series of recommended steps that organizations that are interested in that can take. And we did a training with the National Network to End Domestic Violence. They had a national conference for transitional housing programs in Atlanta last year. where we did an in-depth shelter access training, and then it was something that we were also able to do recently in Montana. We worked with the Montana Coalition Against Domestic and Sexual Violence to do this training for their shelter programs, and it's been really exciting to see the shift and the change. And we had multiple programs following the training that had committed to really figuring out how it is that they're going to start sheltering specifically men, because that would seem to be one of the biggest challenges, and transgender survivors. So this is something that we can offer to anybody who would be interested in receiving this training. Following the training that we did in Montana, we also sat down and had individual technical assistance sessions with the shelter programs that attended to provide some additional, just tailored and specific TA, and to hear about what it is that they're going to be doing. So I'll next talk about the overlap and the uniqueness of both NCAVP and Forge as training and technical assistance providers that can assist the field. And so you can see from what we've talked about so far that both Forge and NCAVP offer some overlapping services, but also have some unique ways that we can support you. NCAVP is more broadly focused on the full LGBTQ spectrum of individuals, whereas Forge really hones in more specifically on transgender and gender nonconforming survivors. Both Forge and NCAVP work very closely together through collaboration, co-training, and making referrals to one another. And we're both very happy to provide training and technical assistance to the field.
That's great. Thanks, Chai, for all that information. As we said before, we know that there are some areas that are really challenging in the Reauthorized Violence Against Women Act. And we also know that the non-discrimination provisions will make sure that more survivors are served, including those victims who are lesbian, gay, bisexual, or transgender. Both NCAVP and Forge are here to help you work through those challenges that you might be experiencing, help resolve some questions that you might have, and help point you in the direction of additional support if and when you need it and we can't support it or provide it for you. We're really committed to helping you better serve your LGBTQ clients. And both NCAVP and Forge are really grateful to be able to have this opportunity today to provide this short webinar. And we know that many of you will have additional questions and will want to contact us in the future. And we appreciate OVW's support in enabling us to help you help your clients.